we have to be that unified voice of relevant and trustworthy information, and we have to be transparent.
Hello, everyone. This is Melissa Vela-Williamson, the Vice President of Social Responsibility for PRSA San Antonio. Thanks for joining us for our 5th and final episode of the 2020 Smart Talk series. Today's guest is Leni Kirkman. Leni Kirkman serves as Executive Vice President, Chief Marketing, Communications, and Corporate Affairs Officer at University Health System in San Antonio. Thanks for being here, Leni.
Oh, I'm delighted. Thanks for inviting me.
You have an amazing background, I know, even as a former journalist. Could you tell us a little bit more about your background and your role today?
Sure. So my career began in journalism. So I have both newspaper and radio reporting background. I moved over to University Health System in 2000 as the public relations coordinator, and really just advanced here in my career. So today I have responsibility for, the complete communications effort, internal, external audiences, as well as our foundation, our philanthropic 501c3 organization. So there's such a link between messaging on the philanthropy side and in marketing, PR, and internal communication. So it's a really good fit, and I'm really excited to be in this role, especially at this moment in time when we've got so much going on here at University Health, and including building a new women's and children's hospital.
Fantastic. It must have been a roller coaster of a ride this year for you.
This is not the year that we anticipated. That is definitely the case.
Absolutely. And we had talked a little bit before, prior to our interview, is that healthcare PR, really is a specialty in the industry. But many of us, whether we anticipated it or not, had kind of a crash course in messaging around healthcare topics since COVID hit. What did you all learn from your position that's maybe unique in this unique time in history?
Yeah, so I thought about this question a lot. This has been on our radar actually since January. We held our first meeting as sort of our emergency response group in January, as we were already concerned the virus spreading in China, and wondering if it was going to be expanded across the globe. And we were already beginning to see tightening in the market for PPE. And so we sort of already had the idea that this was going to in some way impact us, but no way did we think in January that we would be sitting here today, the first week in November, all the things we're trying to worry about now. It really impacted us the night that the NBA canceled their season. And then we also learned that Tom Hanks and his wife had COVID. I was home, and we have a channel. We use WhatsApp for our team. We have a WhatsApp fun channel where people post pictures of their dogs and kids. And then we have an emergency channel that we use really just for emergencies. We do have our notifications on that particular channel. And so that, when we hit that channel, it means you need to pay attention. And so I sent out the emergency WhatsApp that evening, and I said, we're going to stand up our emergency communications efforts at 8 o'clock tomorrow morning. Let's all be there. And so we gathered, and the first thing we did is really think about audiences. Because as a healthcare system, you automatically think that about patients. How are we going to communicate with patients? But we also needed to think about our internal audiences. Our employees were hearing all of the news that we were hearing, and people were going to be afraid. And we wanted to make sure that they're going to come to work, because we are all of us on the front line. So we thought about certainly our patients, we thought about internal communications, and then we thought about our community as a whole. What was our responsibility to, be a source of good, relevant information? Because, as we learned very quickly, a lot of information and misinformation spread so quickly on social media about, take zinc or, whatever those things were. We had to make sure that we were out there and targeting those audiences with the right channels and the right messages at the right level of, medical speak, if you will.
Absolutely. That's a lot of tailoring to be done across different audiences and segments in a very emotional time. So kudos to your team to being so thorough about it. You talked about WhatsApp as a communication tool that your team use, and you also use as in this kind of crisis situation at the beginning when we were responding, right? What kind of communication tools did you work with pre-pandemic that may have been different than what you needed to create after COVID hit our city?
Yeah, a couple of things were already in the works. One is a app called Gozio, and it is a wayfinding app that is specifically focused for healthcare institutions. What's great about Gozio is that it navigates you from your front door basically to the front door of whatever clinic you want to go to. So we were already in the process of standing up that app. We got with them and said, hey, can we stand up this app and really start, because it takes time to get all of that wayfinding. Oh, and then when you get in the hospital, it will take you turn by turn, so to go all the way through our 2 million square feet. So we didn't have that, but we thought, let's go ahead and stand this up with COVID information. It's beautifully laid out. And so it enabled us to very quickly get up visitor information, changing guidelines, locations that were opening. We were having certain areas that were going to be only available by virtual appointments. And so we stood that up very quickly. On the internal side, we stood up a new internal intranet. So our intranet, when this all hit, was very, very old school and not very flexible, no search capability whatsoever. And so we stood this up with the help of Catapult very quickly. And again, we started with really just that critical COVID information. And then as the months progressed, just began to make it more robust. And today that is our full app. So I say those were the two big things. The other platform which we had is our Health Focus blog. We really expanded the focus of Health Focus. It's at healthfocus.net to have more videos, more Q&A, more infographics. And so at the time, we were maybe sending out one email notification with one new story a week to our subscribers to Health Focus. At the height of this in March and April, we were sending out that email daily, and we saw click-through rates and readership rates just exponentially increase year over year, like 1,300%. I mean, just outstanding response rates. We really looked at the data because when it was like how to protect my family, we were like, okay, that's what people want to see. So what are the other things we need to give them and really feed them that really information they were searching for? We saw our search results and the way people were finding Health Focus come through Google searches, extraordinary amounts. So that was told us we were on the right track to answering the questions that people were putting into their search engine.
That's fantastic. It sounds like you had a really great data inspired approach.
Exactly.
Meeting people where they were, especially online and virtually, and serving them up more helpful resources that way. And with that approach, I was wondering too, with all the different channels you had and the different audiences that you tailor for, what kind of messaging strategies seem to work best during the pandemic and as we're continuing on with our COVID operations?
It's experts. When you gave me that question, I wrote the one word. It was really putting the right person. So if it was a story about remdesivir, is this going to be good? How is this trial working? We put on our vice president of pharmacy services, right? If it was something to do with emergency response, it was our chair of our emergency department. So really getting the right person, the right message. Dr. Jason Bowling is an infectious disease specialist and a hospitalist here at University Hospital. He's like my hero now. He made himself in the midst of this so available. And we did a number of QA videos for him, everything from the impact of masks to things to do to, take care of yourself at home if you got COVID. And he really spoke in a way that connected with people. And, we had very strong partnerships with the media. In fact, I forgot to mention them as a key audience at the outset. Media has been an enormous partner. And we've seen the analytics of those Q&A videos that have been posted on KSAT, KENS, and Univision really outperforming other videos. And we're really happy that they're sharing a lot of that data with us. But the experts is really the way to go.
I underline that completely, really having the right type of expert, like you said, with the warmth and that's relatable is very important, but what they have to say helps build trust and kind of calms down any misinformation. So absolutely 100% behind that approach, Leni. Well, since a lot of us had to really start talking about healthcare topics that maybe we didn't do day to day, what should someone who's newer or new to healthcare, conversation topics, resources really keep in mind when they're integrating a continued COVID message or other public health messages that may pop up in 2021?
Yeah, I think we're going to be living this for quite some time. I think it's really important for all of us to understand our community's dashboard that is put out by San Antonio Public Health Department. Understanding, what a positivity rate is, right? Understanding the impact of new hospitalizations, and where we begin to creep into the high and severe crisis scores. Being a source of good information all the way around. Not saying in our organization we wear masks because the mayor and the judge say we have to, but because we're here to protect each other. Really trying in our worlds to tap down the any political messages that get in the way of the science. So educating ourselves is really important. I mean, I know so much more about public health topics than I ever imagined I would understand as we were, looking at the epi curves and just developing that language. I think is really important for all of us, regardless what industry you're in, because we have to be that unified voice of relevant and trustworthy information, and we have to be transparent. That's something that's sometimes harder for our leaders to allow us to do. We've all been through it, right? Where, oh man, if you just let me say it, it'll be a one-day story and we'll just move on from here. And instead they just like, oh no, we can't say that. So being transparent, especially during this time, is really, really important. There was a lot of concern about that at the outset as we saw patients in our hospital and hospitals across the community die. At the outset, the mayor was reporting, the name of the hospital where the patients passed away at, and that was hard for leaders to get their arms around. We've come a long way. We're definitely in this as a community, and we've seen that really among all the hospitals that we were okay with our information being released, because having that data out really provides that transparency to the community to know that, if we're having a surge in deaths, they're going to hear about it. And I think that's been a big plus. And I would say that's a big piece of it for sure. Yeah.
You mentioned that example, and it's a great example of how really this has been almost an experience of building a plane in the sky while you're flying it, communication wise, at least, right?
Oh, sure.
Even in the medical response, I mean, this was so novel to all of us. I think grace has certainly been the right word and frame of mindset for everyone, but, it does take a form of literacy. You were making me think of, we need to be financially literate. We need to have media literacy and understand what's fake news and what's real and what we can trust. And almost now it seems like we need to have a certain acumen around health literacy and understanding how to, cull through that kind of information. So thank you for helping the community evolve our understanding and keeping it pretty consistent and as transparent as possible. So you mentioned the media, and we talked about some of the information that, we should and need to disclose, but, obviously the media inquiries add pressure to any organization, and you received some that I'm sure that were very sensitive in nature to the people involved. And so for example, with COVID, you probably or may have had to respond to inquiries on cases. You mentioned even, people passing away. What best practices can you share with us about that?
Yeah, well, definitely transparency. And even when you're not able to give information, help them understand why you're not able to release that information. For us, I saw personally a number of organizations say, I can't release the general number of, patients in my hospital with COVID because of PHI. That's one of those, healthcare terms that gets thrown away. That's, protected health information. Well, guess what? Aggregate information is not PHI. So if it's not PHI, don't say it is, because, you lose your credibility, and, all of those good things you do to build those media relationships can be really shot very quickly if you are not transparent with them. Even if it's like, I don't have approval to release that yet, I'm working on that. Here's what I can give you. I think that that's important. But in terms of for us specifically, I was thinking about this. I feel like the media has done an exceptional job. It's been difficult for our PR team because for the most part, the media are not allowed to come into the hospital. There have been some exceptions along the way. So our team has had to really package up everything and do it ourselves, which rather than just, escorting a crew, in to go, into an empty patient room and interview a doctor or what have you, we've had to shoot the video ourselves, provide that B-roll, or set up those Zoom calls with our physicians. And at the outset, those were funny, man, because, we weren't really helping them get the lighting right, or, the camera was pointed at weird directions up their nose, So they've learned a lot as well, but that's been challenging. I think the most sensitive thing for us was during the surge, we did have a number of media outlets who wanted to come in just to get a sort of day in the life of what it was like, or what it is like for staff and physicians working on the COVID units. And that was hard for me. We wanted to share that, and our staff wanted people to see the incredible work that I tear up, the incredible work and the sacrifices that they made. And they are heroes, and we wanted to celebrate that. But it was difficult for us to allow that, because at this time we were not allowing family members in to visit their loved one. So how could I justify their loved one, right? Because I was like, well, first we have to consent all those patients. And even if we consented those patients, how can I justify to that family that I let the camera crew from Channel 4 in when your daughter is not allowed in? And so that was super, super hard. So we were really on the couple of patients that we consented, we actually made exceptions to allow them to have a visitor as well. Because if they were doing well enough that I could consent them to share their story on the media, I was like, well, we're going to give you something for that. And I can let your family member in for a short time to visit with you, as long as they follow these protocols, because that was hard. I was like, you just can't come up. It's not fair. It's not fair. The media gets to be in and your families don't. So that was hard. That was the hardest thing, I think.
That sounds very challenging. I so appreciate that you made that extra effort in doing the right thing based on that very individual situation.
Yeah.
It's definitely been completely, novel for a lot of us, and very tricky, and really, coming to that in each decision on a case by case with good intentions, thinking clearly and calmly is the right way to go.
Yeah.
Well, we've talked about a lot of really important things. I think that your, insights are going to be very helpful for a lot of people coming into 2021. And I think we all are starting to recognize that, life's never going to be quite the same. We're going to have more awareness than ever around health and public health. And so for me, that's why I thought this topic would be very appropriate to share during the series. But I definitely like to ask all my guests, the same question, which is, what does the term social responsibility really mean to you?
To me, it means understanding, or trying to understand and meet people where they are, and what their experiences are. We have a trauma-informed care program here that is very much aligned with that too. It's about justice, and social responsibility is about us each doing what we can to uphold integrity, to uphold equality, to tap out even unconscious bias or discrimination in all we do, in the words that we choose. There's some great training out there for PR folks in terms of the terms that we use that we probably don't even think about, that maybe not as responsible as we should, in terms of bringing people along with us regardless of where they are. we can't do everything by ourselves, but I think if everybody tries to just pay closer attention to the decisions they make and the words that they choose, I think we can each do a little and make a big impact together. It's just trying to do what's right and meeting people where they are individually.
I love it. And that continuing openness to growing, because what was okay yesterday may not be okay today. And the more that we know, the better we can do. So
exactly.
Absolutely. All right. Well, I like to finish up just making sure if my guest, did I miss anything that you would like to share, Lynn?
Well, I would just say this is a hard time. You know, we're dealing with so many emotions ourselves, with our families and our loved ones, people we're concerned about, the uncertainty of the future, and big loads at our organizations. We know the responsibilities that we carry. So I guess I would just say, don't forget to take care of yourself. We have to have that right balance of work and life and home life balance. And so don't put yourself second. We have to be as equal, because we can't do our best for our families or for our organizations if we don't take care of ourselves. So do it.
Do it. I love it. Right on. I'm going to go do it right after this.
Good.
Thank you, Leni, for sharing your knowledge with us today. And thank you to our viewers for watching. If you like this video or appreciate some of the insights that you heard today, please share it with other pros that could use some tips and information, and put a comment or a question below. And as always, you stay well.